I'd like to ask the following individuals to come forward, please. From the Lakewood Fire Department, firefighter Scott Kohler, and then paramedic Scott Russell. Also from Rocky, hold one second, we got a few more. From Rocky River Fire Department with Lieutenant Rick Delia, Lieutenant Alan Seipel, Lieutenant Stephen Golobic, firefighter Frank Schaefer, firefighter Nicholas Cernick, I apologize if I butchered that, and firefighter Christopher Toth. Now, this particular case is very dear, actually a fair number of physicians' hearts at MetroHealth. I was involved in the care of this individual when they came to the emergency department, and to be honest, when you hear the story, you'll see why. I think we develop these kind of walls around us when we see really sick patients. We kind of think, oh my gosh, I think there's very little chance they're going to make it, and you kind of try to block it out because it's really overwhelming sometimes to deal with that. And to say I was blown away would be an understatement when I looked and followed up in the computer a month or two later and found out that this patient was still alive. And I think that it just wasn't her time. There was a series of events that I don't know how to explain that happened, and things kind of went together in the right order. And as you'll see, this patient's here with us today. So getting on to the story, on May 17th, 2009, Lakewood and Rocky River fire departments were called to the scene of a motor vehicle crash on Interstate 90. A car had struck the median at high speed, and there were reports of multiple seriously injured occupants. The responding units had a chaotic scene greet them when they arrived, with traffic backing up, and they immediately began identifying the injuries and prioritizing care until more help arrived. The most critically injured of the patients was a 7-year-old girl who was found in cardiac arrest by the first responders. I think any trauma surgeon can tell you that somebody who has a cardiac arrest from blunt trauma, like from a car accident, has an incredibly dismal prognosis. We're talking low single-digit percentage type prognosis. Life support measures were immediately initiated by the two fire departments working together as a team. The team was able to secure an airway and intravenous access and continue CPR, hoping to restart her little heart. The responders knew from the first contact with her that the patient was in serious trouble and was going to need a trauma center as quickly as possible to have any chance of survival. They contacted Metro Lifeline to evacuate her directly from the scene of the accident, and it turned out that there was actually an aircraft nearby sitting on the hospital. They had just dropped a patient off at Metro, and they had not yet returned to base. If they had returned to base, they would have been at least twice as far away from the accident. Meanwhile, responders on the scene were able to get a pulse back on their patient prior to the helicopter arrival. The patient was rapidly loaded up and flown to MetroHealth for trauma care, while the care continued in the back of the helicopter. Although she's had to overcome some significant physical challenges, this little warrior has beaten the odds repeatedly, starting from the moment of the accident. When she arrived at MetroHealth, when myself and Dr. Como, who I saw floating around, one of our trauma surgeons, there we go, there he's hiding in the back there. This little one was pretty sick. She had her pulse back, but she had a lot of serious issues. And I'll never forget John coming out of the operating room. I don't know if you remember coming out of the operating room with a picture of the damage to the little girl's trachea, where basically it was transected, it was pulled apart, which is probably part of why the fire department's had a little bit of a challenge getting an airway in her. And I remember him saying something like this effective, I'm not sure how they did this, but tell them they did a great job. Now, I doubt they knew that's why I was making it difficult at the time, but somewhere along the way, someone was helping them along, and I'm not sure how it worked out great, and I think that's what matters in the end. Aside from the spinal cord injury, a spinal cord injury which has caused her difficulty with moving her extremities, she also had, I said, the complete transection of her trachea, which had to be surgically repaired. The responders secured the airway despite the challenges. Scott Russell of Lakewood Fire Department had the pleasure of seeing his little patient a few months back, and although she struggles with verbal communication some, she kissed his cheek in gratitude, which I think sends a clear message. Although a simple gesture, it's one that reinforced the commitment of not just of Scott Russell, but also all of the responders to the line of work they dedicate their life towards. I'd like to actually ask Dr. Joe Carter from Ear, Nose, and Throat to come up. He has participated in caring for this patient, and he's also going to say a little about it and then introduce, we're going to have a very, very special guest come up to the podium with us. I'd like to invite Kaya Radigan and her grandmother Renee Radigan, please. Go ahead.
Probably one of the most feared complications from our point of view for airway is a tracheal transection or cricotracheal separation. And again, I was just one small link in this chain. And if you think about managing that kind of airway, it's really difficult. You try and breathe them with a mask, something like that, you've got a huge air leak. If you tried to do a surgical airway, you would probably be unsuccessful. In fact, I would suspect you would be unsuccessful. So the fact that this patient was intubated on the scene under those circumstances is really quite miraculous and a testimony to the skill of these gentlemen, especially Scott, who got done, but I'm sure that all of you have that kind of training. And again, we just really think of all the little miracles that happened one after another for Kaya, who's a very special patient to all of us. And to see her recover like this, it was unforgettable, and it really speaks to the teamwork and the ongoing care from the first responders, the emergency room, all through rehab and everything. And there are lots and lots of people that were involved in this, but none of it would have happened if it hadn't been for these gentlemen. So just really want to recognize that. Thank you.
And I should say, in the interest of full disclosure, that Scott Russell's a little bit of a ringer because he's also a life flight nurse. But he was working, serving his community as a member of Lakewood Fire Department on that night. Do you want to say something? All right.
Hi. Again. I'd just like to say, as Dr. Carter said, without all of these guys here, we wouldn't be here. And we all know that. And there aren't words that can say anything close to how myself and my family feel about all of you. It's just, it's been a long year. We had our 1-year anniversary a couple days ago, and we've come a long way, and she's still progressing. But it's true, we wouldn't be here without any of you, and I hope that the whole community can appreciate you the way we do. I really do, because all of you, everybody here, deserves it. I don't think people realize what you guys really do. You don't just drive a big wagon and get cats out of trees. You do a hard job. And there are days that I look at Kaya and I'm so happy. And I sometimes don't know how some of you can handle doing the things you do every day. So thank you, all of you, and everybody out there too.